Welcome to the Vital Spirit podcast. I'm Dr. Kelly Livingston, a naturopathic physician and your guide to a new health reality, one that connects body, mind, and spirit. Together, we'll dive deep into the art and science of holistic healing. Through working with hundreds of women through midlife transitions, I've discovered something profound. Most of our physical and emotional challenges are rooted in a maladaptive stress response. And true healing begins when we regulate our nervous system. Each episode will explore complex health topics in simple, empowering ways, uncover the deeper wisdom within each of us, and share practical tools for nervous system regulation to help you awaken your vital force and create lasting wellness. So, if you're ready to reconnect with yourself, your health, and your purpose, let's begin this journey together so you can experience life more fully human and deeply healed. Hi, and welcome back to the Vital Spirit podcast. I'm your host, Dr. Kelly Livingston, and today is one of the episodes that I think is the most important and foundational ones I've recorded. We're diving into a question that I hear every single week from women navigating perimenopause and menopause, and that is, why do I feel awful when my labs are normal? If you've ever walked away from your doctor's office with normal results, but deep down you know that something isn't right, then this episode is for you. Because the truth is that most conventional lab testing isn't designed to pick up on the hormonal fluctuations, inflammatory patterns, or early terrain shifts that happen during perimenopause and menopause. So today, I'll take you step by step through the labs that I actually run in practice, from insurance-covered blood work to the more advanced functional testing, and I'll show you how I interpret them through the lens of the Vital Spirit method. Let's dive in. Before we get into labs, because trust me, I know I go over really complex and long blood work with every new patient, and there is a point in time where their eyes glaze over, but I always explain that part of the journey in working with me is really learning about your body. It is learning about your labs. So before we jump into all of the lab lingo and mumbo jumbo, what exactly is healing your terrain? Let's touch on that for a little bit. So in naturopathic medicine, we talk all about healing your terrain. So again, you can go back to those first few episodes, but essentially you can consider your terrain as your body's inner ecosystem, made up of your gut health, your hormones, your nervous system, your mitochondrial function, immune system health, and of course, your emotional history, right? So when I talk with a patient about their terrain, I'll often also use the words like vessel. So how is your vessel doing? How is your being? Symptoms are going to show up long before disease does. And when we listen to our terrain, we can stop chasing diagnoses and we can start supporting the whole system. So our vessel, our being, might be impacted by internal stressors like dysbiosis or nervous system dysregulation. It can also be impacted by external stressors, relationships, stressors in the environment. So I'm using labs not just to diagnose, but to actually reveal patterns and guide you on your health awakening journey and make sure that your terrain and essentially your body's ability to heal are optimal. Before we dive into more advanced functional medicine testing and go a lot deeper into what might be going on in the terrain, there's so much that we can learn from standard blood work, but I apply a functional lens. In other words, I look at optimal ranges versus just what the reference range might say. And I think this is really one of the most underutilized strategies in medicine today. So here's where I start and how I assess these panels at Roots Deep Medicine. Most of the time when a patient first comes to see me, they've at least had a CBC or a complete blood count run and potentially a comprehensive metabolic panel. So what's in those? In your CBC, you're looking at things like your white blood cell count, you're looking at immune function, you're looking at red blood cells, hemoglobin, hematocrit, and in your metabolic panel, you're looking at things like glucose, kidney function, liver function. So when I'm looking at more optimal ranges in a patient, I'm really looking at a much more narrow window. So for example, you might have low normal white blood cell count, say your white blood cell count's around a 4 or a 4.5, and that might be a sign of chronic immune suppression. It could also be an elevation can also be pointing to infection or inflammation. So these are things that I'd want to track over time so I know what's normal for you as a patient. Now, hemoglobin and hematocrit, again, functional optimal ranges are going to be different than a conventional range. A low normal level might reflect subclinical anemia or a nutrient deficiency. These are all things that I'd love to see in that new patient's first visit. I'm also going to be looking at things like MCV or red blood cell distribution width, and that can also be a sign of, for example, B12 deficiency or a folate deficiency when those are off. It can also reflect chronic inflammation. I'm always looking at liver enzymes and the ratio. So, elevated liver enzymes such as your AST and ALT absolutely can indicate liver stress or need for detoxification. But I'm also counseling patients on the fact that their liver enzymes will take a really long time to reflect liver injury. And so, these are not things that we're going to wait to address. We're going to talk about supporting liver health, supporting detox before those liver enzyme numbers even get high. And then ALP as well isn't going to be in that metabolic panel. And so a low ALP might indicate a zinc or a B6 deficiency. And when high, it can be related to bile flow or even bone turnover. In that metabolic panel, I'm also getting a fasting glucose number. So optimal for me might be between 75 and 85, but you're not going to be flagged unless you're above a 90. So again, you might have insulin issues, blood sugar imbalances, and I'll talk about fasting insulin in a minute, and that might not ever show up on your metabolic panel until you're symptomatic. And I'm also looking at kidney function in this panel. So again, I'm looking at things like electrolytes, sodium, potassium, chloride. I'm looking for subtle shifts that might reflect adrenal function, hydration. And these are all really important things to take notice of before they become a dysfunction or disease. Now, I can put this in the show notes for you, but if you're really curious and a true DIYer and you want to do this on your own at home, I really love this blood chemistry and CBC analysis book. I think I've had this for almost 15 years now. I'm sure they have a newer version of it. But if you're a practitioner or a DIY patient looking for more information on how you can really go in depth into that CBC, in depth into that metabolic panel, and understand all the nuances, I highly recommend that book. Now, also through insurance, I'm going to be looking at a complete iron panel. So I'm looking not just at your total iron and saturation and all of those numbers, but I'm also looking at ferritin. Ferritin is your storage form of iron. When it's below 40, it can signal low iron storage. It's going to affect your energy. It can impact your thyroid function. I see so many women that have lower ferritin through perimenopause and menopause. So if you've been getting your period, and especially if you've had children, there is a chance that your storage form of iron, that ferritin, is low, and it absolutely contributes most specifically to low energy in my practice. Also, we're going to look at folate and B12, but even beyond that, I'm going to look at something called methylmalonic acid, which is a functional marker for B12. So, when elevated, I'm really going to consider that B12 is suboptimal. And definitely B12 in the serum under a 500 is something that I would flag for a patient, also going to contribute to low energy and sometimes even low mood. B6 is also a really important B vitamin marker that I find deficient and low in so many patients. It will be low with chronic stress and with birth control use, and it is a cofactor that we need to make healthy neurotransmitters in the right amount and for hormone metabolism. So it's really key through perimenopause and menopause. So checking B6 is a really great strategy, and you can even run a B6 micronutrient panel to get a more accurate idea of the amount of B6 that you have working for you in your body. I'm also going to look for optimal vitamin D ranges. So, optimal range, I would say, is between about a 60 to a 90, going to be different for everyone, but vitamin D is so important for immune health. It is a prohormone, so it's really important for manufacturing your hormones. It's important for bone density, which can become a really big focus as we enter into perimenopause and menopause. And it's going to be important for your mental health. So, I highly recommend you track your vitamin D, especially if you live in the Northeast of the United States of America like me, and you're not getting as much sunshine in the fall and winter months. And then omega 3s. So, omega 3s are low in so many of the patients that I test, and I run an omega check through insurance. And these are necessary to counter inflammation in our body. They're really key in supporting brain health and nervous system. And omegas are important for almost any condition that a woman might come to see me with in perimenopause and menopause. We need all our healthy essential fatty acids to make our hormones. And then homocysteine. So, homocysteine, ideally, we want under an 8 or 9 is kind of my goal in practice. An elevated homocysteine can be a reflection of poor methylation, which is something I'll talk about in a little bit. It can also be a sign of a B vitamin deficiency, so folate or B12. And I also like to explain homocysteine as an important inflammatory marker, especially when you're looking to minimize your cardiovascular risk. And speaking of inflammation, I run in every new patient something called high sensitivity CRP or C reactive protein. And I will often also run IL-6, especially when there are signs of a mental health issue, anxiety, or depression. So, HSCRP in particular is an inflammatory marker, and it is going to tell me more information about your cardiovascular and metabolic risk. So, again, these are really important things to track through perimenopause and menopause. And that brings me to blood sugar and insulin. As we're going through perimenopause and menopause, one of the complaints that I have hear from a lot of women, and again, when I say complaints, chief complaint is how we chart what a patient is coming in to tell us in their visit. So one of the chief complaints that women have is that they're gaining weight, especially around their abdomen, or that it's more difficult for them to lose weight. So it is extremely important for you to know what your fasting glucose and fasting insulin numbers are, as well as your hemoglobin A1C, which is a 3-month average of your blood sugar. These are going to change as we age. Fasting insulin being higher than I'd say 5, 6, definitely anything above a 7 can indicate early insulin resistance, even if your glucose looks normal. Hemoglobin A1C, I like to see between a 5 and a 5.4, and higher levels of that are going to signal chronic blood sugar stress on the body, on the system. You're going to be more predisposed to diabetes, for example. And this is really important because blood sugar dysregulation can also be a root cause for anxiety. So many times women come to see me, and maybe we focused on weight gain through perimenopause first. And as we uncover their blood sugar dysregulation and we work on balancing that, they notice, oh my gosh, my anxiety is gone, because blood sugar dysregulation can be a big root cause of anxiety. It's also really important for hormone balance in general. Next would be our cardiovascular risk markers. So, women have a very high cardiovascular risk as they get older. I should say their cardiovascular risk increases as we get older. And so, I'm not only looking at the standard lipid panel. So, yes, I'm looking at cholesterol, I'm looking at your HDL and your LDL, right? But I'm also looking at things like your triglyceride to HDL ratio and a functional marker of insulin sensitivity, which is your TG to HDL ratio. So ideally, I want that less than a 1.5. I also explain to the women that I'm working with that triglycerides are often a reflection of the amount of sugar in the diet. And definitely, I have a whole handout on cholesterol, understanding cholesterol, why it's so important. You actually make all of your sex hormones from cholesterol. Cholesterol comes in, it becomes that pregnenolone, mother hormone precursor, and then it becomes all of our sex hormones. So cholesterol is important. We need it. And then our body makes it in response to inflammation. So triglycerides being high or even total cholesterol being high is not necessarily an issue of cholesterol in the diet. It's very often a sign that your liver's making too much cholesterol. It's a sign that there's a lot of inflammation or even sometimes blood sugar dysregulation that's creating that high cholesterol. So there's a lot of layers to that, but in and of itself, cholesterol is not the bad guy. I'm also looking at things like lipoprotein A and apolipoprotein B when I'm looking at cardiovascular risk. And again, I'm including things like that homocysteine and that HSCRP in my comprehensive cardiovascular risk workup. When we do lose the protective cardiovascular effects of estrogen, cardiovascular tracking is essential. And then we have our thyroid panel. I've talked about this in some previous episodes, but we're not just looking at TSH or thyroid stimulating hormone. Remember, your thyroid works on a negative feedback loop. So if your body doesn't have enough thyroid hormone, which is actually a reflection of T3, which is your active thyroid, it's going to send a message back up to your brain saying, hey, I don't have enough of this. Can you make more? And so then your brain is going to make TSH, which then tells the thyroid, make more thyroid. So this is all happening through the pituitary gland. And the best way that we can track this and monitor this is by not just looking at TSH, and certainly not just looking at this super wide range for TSH, which is 0.45 to 4.5 in Quest Labs, for example. But number one, I'm explaining to patients that ideally your TSH is between a 1 and a 2. And again, I can track that over time and see if that's going up or down for a patient. And when that TSH goes up, it's actually a sign that your thyroid is subclinical. So then I'm going to go a step or many steps further, and I'm going to run free T4 and free T3. Free T3, again, is that active thyroid. It has to be converted from T4. And a lot of things can inhibit this conversion process. Things like high cortisol and stress, things like not having enough of the ingredients or precursors to make that conversion happen, right? You can also have something called reverse T3 high, which can be elevated again with stress, with trauma, and with chronic illness. So you're not having enough of that active thyroid doing its job in the body. You might have symptoms of this. You might have low mood. You might notice that your hair is falling out. You might have dry skin. You might be gaining weight or have constipation. So a full thyroid panel is so important. And then additionally, I do always run thyroid antibodies. So that's anti-TPO and anti-thyroglobulin antibodies. I like to know, is this patient showing a low or underfunctioning thyroid because of an autoimmune, such as Hashimoto's, or is this something totally different? So there is so much that can be done when you're looking at thyroid. And yes, I run all of these through insurance. Next is your sex hormone. So when a woman comes to me and they say, oh, I went to my doctor and I asked them to run labs and they said labs don't matter because my hormones are changing, I get so frustrated. Yes, of course, your sex hormones are changing. For women, they're fluctuating throughout our cycle. That doesn't mean that you don't want to run them. I'm not talking about when you're using hormone replacement therapy, and some practitioners who are prescribing that might say that they're going to prescribe based on symptoms. That's fair. That's true. I'm talking so much more about all the fluctuations that can happen, not just in estrogen and progesterone, but in things like DHEA, pregnenolone, prolactin. There's so much more that can be looked at. And if you're looking at your hormones at the right time of the month, then you're going to get a much better idea of, is progesterone declining? Is estrogen too high, right? These are all extremely important pieces of information to track through perimenopause and menopause. So let's start with estrogen. I'll typically run a fractionated estrogen, and I will explain to patients that this is going to change over time. But I might be able to see, for example, that your estradiol or E2 is exceptionally high. Very often we can have these estrogen surges during perimenopause before estrogen drops postmenopausally. So I'm going to look at that in a patient. It also might reveal patterns around detox issues, for example. Progesterone, which is the hormone that commonly starts to decline in early perimenopause, I talked about this in the last episode, is going to greatly impact mood, anxiety, and sleep. As progesterone starts to drop, sleep issues are one of the first things that those patients are going to complain to me as a practitioner about. So progesterone is really key and important in making GABA, and that's something that I will absolutely look at in a new patient visit. And of course, testosterone. So I will look at both free and total testosterone and sex hormone binding globulin. So low levels of testosterone can contribute to fatigue, lower libido, kind of loss of drive or motivation. And oftentimes this can be low in women in that perimenopausal and menopausal stage. And sex hormone binding globulin is essentially the protein that binds your sex hormones. So when it is low or high, it's going to impact the amount of available sex hormone for your body to utilize. And it can certainly impact things like estrogen dominance or low androgens, low testosterone, for example. DHEA sulfate is something that I can also look at in blood work, and this is a marker of adrenal resilience. So, most people have heard of cortisol, that stress hormone. DHEA is actually also made by the adrenal glands, and it does decrease over time as we age, and it is a precursor to testosterone and estrogen. So, when we're looking for root causes, or I'm certainly looking along that sex hormone pathway for places that I can intervene naturally and support the body, DHEA is one of those places. And that brings me to one of my favorite hormones to test, which is pregnenolone. So, pregnenolone is a precursor, it is that prohormone. It's a precursor to progesterone and cortisol down one side of the sex hormone pathway. And then it's a precursor to DHEA, testosterone, and estrogen down the other side of the sex hormone pathway. So, low pregnenolone is related to poor memory and cognition, and certainly to chronic HPA axis stress. It is seen to be low in major depressive disorder and in post traumatic stress disorder. So, it's something that I look at in almost every new patient, or certainly at some point as we work together on hormones. I like to explain pregnenolone to patients kind of like turning on the faucet for your hormones. So, if, for example, you weren't getting enough cholesterol to become pregnenolone, then you might not be making enough of your sex hormones. And very often patients will feel a lot better when pregnenolone and DHEA are optimized. And prolactin as well can be looked at in that blood work, and that can reveal pituitary stress, estrogen excess, or it can be depleted post birth control use and postpartum. And again, I'm making sure that I do look at that ferritin and a full iron workup, especially if women are coming to me with heavy periods. And last, I always look at chronic viral load or stealth pathogens. So, this might not be run in the first visit unless that patient has some symptoms that warrant these. As you can tell, there's a lot to look at in a new patient's first visit. But I certainly look at things like Epstein-Barr virus reactivation. So, I might run an early antigen D to see if there's a reactivation of Epstein-Barr virus. That will be associated with fatigue, with frequent infections. Sometimes I'll work on that in my autoimmune patients or patients with brain fog, for example. And then I will often also run candida antibodies in the blood work. And that can sometimes tell me if there is a chronic issue with candida being overgrown in the system. So remember that terrain. When our terrain is compromised, maybe our immune system isn't functioning as well as it could be, or maybe we have other dysbiosis or an imbalance in good and bad bacteria in our microbiome, that can give stealth pathogens or things like candida the opportunity to overgrow in our body. So that may be something I look at in blood work as well. And then I do typically do an ANA screen or an anti-nuclear antibody screen, especially in women who have a history of autoimmune disease. Very often that ANA titer or pattern will come up as positive, and it is something that I will work on reversing in patients. So you can see before I even run any fancy functional medicine tests, there is a lot that can be looked at in your blood work. And remember, most reference ranges are based on population averages, not optimal health. They're based on 95% of the population. And as the population gets more metabolically unwell, that normal range is essentially meaningless to me. And because I work so much on optimal health and on prevention, there are many, many labs that I will track over time. So a woman might come in to see me about a perimenopausal symptom like anxiety or sleep issues, but I'm certainly going to educate her on things like HSCRP, homocysteine, how to make sure that she's not at a higher risk for a cardiovascular event as she gets older, right? These are all really important to how we practice that roots deep medicine and working through the vital spirit method. So some of the things that we're really trying to make sure that we optimize and rule out would be subclinical nutrient depletion, early metabolic stress, early fluctuations in things like insulin and glucose, hormone rhythm disruption. So again, if I've had a patient that I've worked with for 10, 15 years, I can go back and say, oh, wow, your pregnenolone has really declined over the last 5 years. Let's work on that and see how it helps balance your sex hormones, your mood, your sleep. I'm also tracking immune and inflammatory activation over time. So again, if you come in and you're not feeling your best and you know something is off, I can go back and look and see. And in our practice, we always upload patient labs right to your portal. We share them with you. I invite patients to add labs from other practitioners to that portal. So it becomes a central hub. And I function very often kind of like the quarterback in a patient's healthcare team. So I can say, okay, this is what we've looked at over time. Let's add what that other specialist brought to the table and let's all put it in your portal. Let's share the information. I wish every patient had access to labs on a yearly basis because I really truly believe that we would prevent so many of the health issues that I see in practice. So while these labs do give me a great starting point, they're still only part of the picture. I never practice what I call plug and play medicine. So I'm not going to just say, oh, your iron's low, let's give you iron, or oh, your cortisol's high, let's give you some adaptogenic herbs to bring that down. They're really just a piece of the puzzle. I'm going to ask, why is your iron low? Why is your cortisol high? So while these conventional labs, especially when interpreted correctly, can really play a powerful role in your health trajectory, they can leave some questions unanswered. And that's where specialty labs come in. These deeper specialty labs really do allow me to map your terrain and uncover hidden patterns and offer truly personalized care inside the Vital Spirit method. If you're curious to explore this further on your own, I've curated a brand new lab shop through Rupa Health so that you can actually go in and order labs on your own if you're someone who did want to do it yourself. And if something stood out to you today as you were listening, you can certainly get some of those answers for yourself. You can browse and order some of the same advanced panels that I use in practice as well, that I'm going to talk about in the second half of this episode. As we close out this first part of our lab deep dive, I hope you're beginning to see how powerful and revealing these so-called basic labs can be when they're interpreted through the right lens. They're really not just numbers on a page, they're storylines, they're patterns, and they're messages from your inner terrain. So I highly recommend that you go back and try to get some of the lab workups that you maybe have had done in the past all together. And you can start tracking those numbers. Have they changed over time? And if you even start to look up and Google what optimal health ranges are, it can be so powerful and empowering to see that, yes, things are changing. It's not just that you don't feel good and your labs are fine. I also have a blog post on this topic, and I have a handout on ideal lab reference ranges for you. So you can go to the show notes and download those. And this is really what it looks like to work with me in the Vital Spirit method. It's where curiosity, context, and connection are key to healing. So I want to know the context of those lab numbers. I don't just want to know this is high, this is low compared to the typical population, right? We're not here to just throw supplements at symptoms or chase lab numbers. I'm really here to listen, to hear your experiences on a daily basis, to hear what your symptoms are, and then to trace that back to the why, truly restoring your vitality at the root. So, whether you're dealing with exhaustion, irritability, stubborn weight gain, sleep issues, anxiety, or just a sense that something is off, these labs can give us the language to understand what your body's been trying to say all along. And in part two, coming next, we'll dive even deeper into the functional lab tests I use. So, for example, what is the stool test all about? And how can we look even more in depth at your hormones to map your terrain? You'll learn how I use specialty labs to uncover root causes of inflammation, hormone imbalance, brain fog, immune dysfunction, and emotional burnout, and how we integrate those insights into truly personalized, soul-centered healing at Roots Deep Medicine. So, if you've enjoyed this episode, please subscribe and download so you don't miss any of them. And you can share it with someone who you think might need to look into their labs a little more in depth. And I recommend that you check out my lab interpretation handout and my lab shop through Rupa Health. And just remember that you are not broken. You are becoming on your health awakening journey. And I'm so glad that you're here.